The first step in obtaining a good reflex is proper technique. Hold the hammer loosely between the thumb and index finger and use a pendulum-like swing. The next step in obtaining a good reflex is proper positioning of the patient. Generally, the patient is seated in a relaxed position with area to be tested adequately exposed. Palpate the tendon to be tested. Put the tendon on slight stretch. To obtain a biceps reflex of nerve root C5, have the patient in sitting. Flex the patient's elbow to approximately 45 degrees. Palpate the biceps tendon in the antecubital fossa. Place your thumb over the tendon while the rest of your hand supports the arm under the elbow. Strike your thumb with the reflex hammer rather than directly striking the tendon. Watch for a contraction of the biceps muscle. To obtain a reflex of the brachioradialis muscle of nerve root C6, have the patient in sitting. Flex the patient's elbow to approximately 45 degrees and rest the forearm on your arm. The patient's forearm should be in slight pronation. Place your thumb over the tendon about 2 inches above the wrist. Strike your thumb with the reflex hammer rather than directly striking the tendon. Watch for pronation of the forearm and flexion of the elbow. To obtain a reflex of the triceps muscle of nerve root C7, have the patient in sitting. Hold the patient's upper arm in 45 degrees to 50 degrees of abduction, allowing the elbow to passively flex. Palpate the triceps tendon just above the elbow and strike it directly with the hammer. Watch for contraction of the triceps muscle or extension of the elbow. To obtain a reflex of the patellar tendon of nerve roots L3 and L4, have the patient in sitting with legs dangling over the edge of the table. Strike the tendon directly just below the patella. Watch for extension of the knee. To obtain a reflex of the Achilles tendon of nerve roots S1 and S2, have the patient in sitting with legs dangling over the edge of the table. Put gentle pressure on the sole of the foot to place the ankle towards slight dorsiflexion. Strike the tendon directly approximately 1 inch above the calcaneal attachment. Watch for plantar flexion of the ankle. This is a demonstration of a patellar reflex graded as a 0, with no response. This is a demonstration of a patellar reflex graded as a 1+. Present but depressed, low normal. This is a demonstration of a patellar reflex graded as a 2+. Normal. This is a demonstration of a patellar reflex graded as a 3+. Increased, brisker than average, but necessarily normal. This is a demonstration of a patellar reflex graded as a 4+. Demonstrating a very brisk, hyperactive reflex with clonus, which is abnormal.